Hello everyone, I am the leader of Group 2. Now we are going to present the case of our neuro-ophthalmology.
General data, patient name is X. Chief complaint was found to be blurring of vision of the right eye. History of present illness includes patient came to the clinic because of blurring of vision with visual acuity of right eye 20/70 and the left eye with 20/20. The results of color vision test using Ishihara is 6/24 for the right eye. Fundus examination of right eye revealed pale disc. Review of systems. In general system, there was no fever, chills, malaise, myalgia, fatigue, nausea, and vomiting. In skin, there was no rash, no color change, itching, and visible mass. In ophthalmology, there is blurred vision, but no pain, redness, glaucoma, and cataract. Neurology systems, there was no headache, dizziness, blackout, numbness, vertigo, orientation changes, slurred speech, forgetfulness, and mood changes. In past medical history, there is no history of any surgeries or any other ophthalmologist conditions found. In medication and allergies, there's no known medications used and no known allergies found. There was no information regarding personal and social history and family history and occupational and recreational activities provided. In physical examination, if we see visual acuity, the visual acuity of the right eye is 20/7, but in the left eye, it's 20/20. In color vision test, it is found to be 6/24. In left eye, it's 24/24. Extraocular movements were full in both the eyes. If we see pupil examination, there's 3 to 4 mm dilation and there is relative afferent pupillary defect in the right eye and there is no abnormality found in the left eye. In gross examination, there's no ptosis, no mass lesion, no redness, no discharge, and no asymmetry in right eye, and similar examination of gross in left eye. In finger tonometry, in both the eyes, it is soft, and fundoscopic examination is also found to be normal, except in right eye, which is pale disc. Salient features include blurring of vision, visual acuity 20/70 of the right eye. There is relative afferent pupillary defect in the right eye, pale disc on fundoscopy, and color vision was found to be 6/24 in right eye. So according to all the details provided, our initial impression is optic atrophy. Optic atrophy is not a disease, but rather a sign of potentially more serious condition. Optic atrophy results from damage to the optic nerve from many different kinds of pathologies. Point to be considered in making this diagnosis includes blurred vision in the right eye. There is relative afferent pupillary defect in the right eye. There is reduced visual acuity, that is the reduction in sharpness of the vision in the right eye, and there is impaired color vision of right eye, and the optic disc of the right eye is found to be pale.
Now, the differential diagnosis for our initial impression is optic neuritis, ischemic optic neuropathy, and diabetic retinopathy. Now we will see each in detail. Optic neuritis. The optic neuritis refers to inflammation of optic nerve due to many reasons. Optic neuritis is the most common optic neuropathy in persons under 50 years of age. And it is likely due to some inflammation process which lead to delayed type 4 hypersensitivity. It leads to the death of neuronal cell and axonal degeneration. And the rulings and rule outs for our optic neuritis is, the rulings are loss in visual field loss of color vision, visual acuity is decreased in our patient, and the rule outs of this condition are, there is no eye pain seen in the patient, and there is no complete vision loss in one eye, and there were no flashing of the light in the eye. Now going to ischemic optic neuropathy. Ischemic optic neuropathy are the most frequent acute optic neuropathies in patients older than 50 years of age. So ischemic optic neuropathies may be categorized based on their location, like on the presence or absence of temporal arteritis as an underlying etiology. Now, next, anterior ischemic optic neuropathy presents with sudden, painless visual loss developing over hours to days. And examination findings usually include decreased visual acuity, visual field defects, and color vision loss, etc. Next, the rulings and rule-outs for our condition ischemic optic neuropathy is, the rulings are blurred vision, decreased visual field, and the rule-outs are, there is no pain in the temples of the patient, no pain in chewing, scalp pain or tingling sensations are absent, there is no neck pain also seen in our patient. Now coming to diabetic retinopathy. It is a classic condition where we see in a diabetic patients where the diabetes is poorly controlled. So early stages of diabetic retinopathy do not have any symptoms. Some people notice changes in their vision, like trouble reading or seeing faraway objects. And these changes may come and go. And now, going to rulings and rule-outs. The rulings are, there is blurred vision and decreased visual field in our patient. And the rule-outs for this condition are, there are no spots or dark strings floating in the vision of the patient, and there is no fluctuating vision, and there is no dark or empty areas in the vision, and there was no complete vision loss in the patient. So after this all, the final diagnosis is optic atrophy. Now we will see the pathophysiology of optic atrophy. So generally, it is due to acute low systemic blood flow. So whenever the blood flow is decreased, it will lead to ischemia of the neurons of the optic nerve. So then it leads to optic nerve fiber ischemia and then leads to atrophy. So it may be also due to compression of peripapillary capillaries, and it leads to optic disc edema, and it will contribute to further slowing of blood flow, and again the optic nerve becomes ischemic. It is a continuous process. So in this, we will finally see the atrophy of the optic nerve. Next, the treatment. Coming to the treatment in these conditions aims at treating the underlying cause. And one more thing we need to remember is, even we treat the patient, we will just control the severity of the disease to progress, but we can't bring back the vision of the patient. So treatment is according to the cause. However, high dose of vitamin B1, B6, B12 are given. Hydroxycobalamin, vitamin B12 is administered for the atrophy due to toxic optic neuritis.